I think there is a problem with with this connection. My phone. I gonna use my phone. Internet is bringing some issues now. I can't use the internet. End stream. Not yet. Please check the other. Please check the other link. I really don't know why this thing is giving me. Can't find my connection. It's connected because it. Yes. Today I have to use my phone. My my internet has got issues. I can see Sha Travels already in the house. Welcome, Sha Travels. I can see here. Now we were talking about EKG and internet brought problems. So we'll just go by the talks because I have to rectify some things. I think there is a problem somewhere. Yes, welcome. Rogers, I can see you. Boom, I can see you. Rogers, please tell Jamaican uncle I'm on. He told me when I'm on, I tell him, but you see the internet has brought some issues, so I have to use the phone. So we were talking about electrocardiogram, and we analyzed every aspect of electrocardiogram. We saw the P wave, we saw the R wave. I think it's here in my back. The P wave, the R wave. Let me show people P wave and the R waves. P wave and the R wave. Yes, that's right. Now, what we were drawing behind me, this is what is seen behind me here. The P wave, the R wave, the Q and ST wave. We have defined. Dr. Ben, I was about to call you the popo to come and search for you because there was no one there. Game over. No. It's about the internet. The internet is being so slow, so I have to use my phone right now because I cannot go without having a stream. Now, to see how it's going, we say after the effect of the sinoatrial node, I can put this on. If you have a question concerning anything, concerning the heart, concerning anything, please put it up because our work is to interact, talk to people, make people know that we are here, make people know that we discuss medical issues. What is the topic about, please? We are talking about diagnosis of heart conditions. Yesterday we took our patient in theater, in the laboratory. We took blood. We saw every aspect that we can look in blood, like the troponins, the creatinine levels, that we can look in blood to see if this person has a problem. But after the laboratory, now we are going to the radiology department to the radiology department, what are we going to check in the radiology department? We are going to search inside the heart to see where the problem is. I shared the link to Jamaican Uncle. Nice, Roger Skillia. Now, when we are going to the radiology department, you have seen we have several things there, like the cardiac ultrasound, angiography. We have the X-ray. X-ray is part of the cardiac diagnostic tool, because when you do an X-ray, if someone has an enlarged heart, what will it show? It will show as a boot-shaped what? It will show as a boot-shaped heart, like a heart that someone is having a boot shape. You get it? So it is important. It is so important that we learn these things, so that when you, even if you are not a doctor, you know what your patient or your relative is about to be done, something that this patient will go through. So don't forget to give me, as you are checking, don't forget to subscribe if you are new here, and don't forget to like, man. Please put that like, share with me, and if you have any question that is not even, yes, come in. Sasa. Oh, good night. So we continue, and we say that when you look at this is hash brown. I am studying engineering, but I'll ask a medical question that the heart keep beating if it's outside the body. Yeah, hash brown. You know, when your heart is outside the body, it can be stored so that it can be transplanted to someone else somewhere. So when it is outside the body, it is freezed, not to beat. You get? But when it is inside the body, the electrical system is excited. Hash brown, make sure you subscribe to my channel, so that you can be following up with medical issues. We are talking about this thing, the sinoatrial node, the atrioventricular node. So the normal way of beating, we said, is this one produces the excitement node. After the excitement node, it comes to sinoatrial node. So the excitement node, after the excitement node, I want everyone to see, so let me push this place here. So after the excitement node, which is the sinoatrial node, which brings the excitement node, we get the P wave. After the P wave, it comes here. The delay is the straight line, and then we have the R wave. After the R wave, now the ventricle starts to constrict. This thing that is called the PQRST is a continuous thing from the electrocardiogram that enables us to know that the electrical conducting system of the heart is normal or it's not normal. So hash brown 2007, the heart can beat even if it is not outside the body, but it will not beat for long if it is not freezed. Because one, it needs blood supply, it needs some nutrients, and if it stays away from the body for long, what will happen? It will die. It will die. So we freeze it, stop the electrical conducting system, so that when it is transplanted, it can be excited and start to beat again. You see that? That is an important thing in the life of the heart. Now, we have talked about the seconds. PQR interval, P to Q, PQR takes 0.2 seconds. And then we say ST takes how many seconds? Hash brown. Thank you. Hope you have subscribed and share hash brown to your friends. Subscribe to the channel. Are very important, and likes too are very important. So PQRST is 2 seconds plus 0.2 seconds. So one cycle of heart beating equals to how many, what can I say, is equals to how many cycles you know, it goes like this, the heartbeat, poo, poo, poo. So it takes time, and those electrical conducting system of the EKG are placed, and you see them on paper. So let's continue. Paper basic, we have said 0.0, small box is 0.04, large box is 0. Those ones I will not read. How to read the EKG? Normal sinus is, the normal sinus beat, heart rate is 60 to 100. 60 to 100 beats per minute. And then we have a regular beat. We have a regular beat and we have irregular beat. So let me see common issues when your heart is beating slowly or faster. Let's see how it entails. Now, maybe your coronary artery vessels, check at this part, your coronary artery vessels here have a blockage. I'm late for the login. No, you are not late, Ridley, you are here. And then the blood supply is in here in this side of the heart, which is the right ventricles, is not okay. A part of this ventricle can die. And if a part of this ventricle can die because it's not getting oxygen or the required nutrients, I'm working still from last night. Okay, really, it's okay, no problem. What can happen? This is where we go back to the electrical conducting system, where we get myocardial infarction. Myocardial infarction. You see, let me place today. I'm having a very hard time. Now, the myocardium is there. The myocardium. So this myocardium can die here or here. So when the electricity is coming and it reaches where the myocardium is dead, what will happen? This is what will happen. The electrical system will go slow, or it will go faster. It will not go, because the place that the bundle is supposed to pass, the electrical system, is not there. This is where we get some obstruction. So look at this paper of mine. Look at this paper of mine. Instead of it going, let's say that we get the ventricular side. If I want to graduate this side, so this is what will happen. You can get, because it is taking slowly, the electrical system. I have another question. What is the difference between heartbeat and blood pressure? Oh, okay. I will answer that. What is the difference between heartbeat and heartbeat? And in athletes, they have low beats. Why is it? Take your time. Okay, I'm answering that, no problem. I'm answering that. Now, this is the heart muscle. Somewhere here there is a problem. So this is what happens when the electrical conducting system reaches here. If it is blocked, you will see this, because this is the ventricle and QRS is the ventricular system. It will be like this. Because you see what I'm drawing? Because it's not sharp. The electric system is not passing as per needed. And we will know maybe at the ventricular system, at this part, there is a problem. And that's now how we know there is a problem in the right ventricle or in the left ventricle. Because of what? Because of the placement of what? Of these knobs, according to where they are. So if the lead 2 is facing this one, this way, and you check on the script, and then you see that lead 2 has a deviated RS T wave that is up, you will know that this place of the heart, like the left ventricle of the heart, is having this problem. So we go to the left ventricle and then we check, we see if the heart itself at the bundle of his, there is a problem. You remember when I was talking about a stent, those that are born with another producing electrical system at this place. You remember? We backtrack now. Greetings, Benjamin, the wise guy. Welcome, Efasi, welcome, Emphasis Lipenga. Those that are coming in now, I'm seeing we are having many new people. Please continue liking, The Kent node, it is called the Kent node. So if the Kent node is producing an irritable focal point, producing, and it is making this continuously having around, you will get another paper. Let me get another paper. Someone is trying to call me. Hello King Ray, welcome to the talk. You see, if you are getting an irritable focal area like the Kent node here, now you will not get this PQRS that you are seeing here. Irene Hay said hi. Irene, welcome. If you have not subscribed, please subscribe. And using a focal point, you remember the bradycardias, the tachycardias that we were talking about, yeah? Bradycardias, tachycardias, those are irritable areas that are producing focal. The sinoatrial node is producing electrical system so fast. You will get something like this. Because now we have said this area, P wave, is for contraction of the sinoatrial node to let blood to go. So instead of getting a P wave that is like this one, you will get a P wave that is very sharp. You get? And if there is a Kent node that is producing a non-return, these nodes will be like this. You get? So that is how we learn. We check at the ED, and we know there is a problem this side. Now we continue. We've said there are some readings that we need to know when we are learning about the EKG. There are some readings we need to know when you are learning the EKG. Like normal rate is 60 to 100. 60 to 100. Now, how to determine a patient who goes for EKG? Some factors. If you have a question, because I have a question by someone known as one of our new subscriber here, he has asked, I have another question. What is the difference between heartbeat and blood pressure? What is the difference between heartbeat and blood pressure? That question, we have answered it several times, but I'm gonna answer it again as we continue to check. If you have any other question on the platform today, internet messed me up so much. If you have any other question, a random question we can talk about, you can place it up. We see what how we can help you and how we can talk. Now, these are the factors that are important in an EKG. One, we check for something that is called the heart rate. Heart rate is wait a minute. That question of Harbon, I have another. Where is it now? This is going to Hash Brown 2007, our new friend today. Heart rate is how fast the heart is beating. Normal is 60 to 100 beats per minute, and that one can be shown with the EKG. And then we have heart rhythm. Determines whether some noise coming from somewhere. Okay. Heart rhythm determines whether the heartbeat is regular or irregular. You get it? It determines whether the heart is regular or irregular. And also, it is very, very important because irregular heartbeats can have other issues in life. Maybe you have maybe you have a focal arterial node that is beating in an irregular way, and it can cause stroke, because irregular heartbeat with tachycardias can cause a clot in your system, and causing a clot in your system means getting a problem. Let me get some power here. So when you get someone is having irregular heartbeats, and we talked about irregular heartbeats, we talked about several things. Like one, we talked about, let me put here, sorry, we talked about normal sinus rhythm. The sinus rhythm is when the sinoatrial node is producing the electricity in a normal way. And then we have atrial fibrillation. Fibrillations are faster heartbeats, fibrillations. And then we have, I know these things, we have talked about them. And then we have arterial flutter. You remember arterial flutter? When the heart is beating so fast, and then now it has gone until it cannot beat again. It's beating without any, like a generator, faster like a generator. That is called arterial flutter. Now, if you are here, if you are here and you have not liked the video, please like the video. I'm still working on something as we talk. So that is called arterial flutter, when the heart is beating so fast without any stop. And then we have another one after arterial flutter, ventricular tachycardia. The ventricles beating so faster. Ventricular tachycardia. That is the rhythm of the heart. It's either normal sinus rhythm, the sinus at the arterial is beating normally, arterial fibrillations, arterial flutter, or ventricular tachycardias. Now, we continue. There is something called the cardiac axis. Refers to the direction of electricity or electrical conduction through the heart. Types, normal axis. Yeah? How the normal axis is. The normal axis whereby the sinoatrial node hits a delay to the atrioventricular node, then it comes to the bundle of His. After the bundle of His, we come down and then it spreads for contraction. Then we have the left axis deviation and the right axis deviation. You see, we have the left axis deviation and the right axis deviation. This is the normal. Guys, I will be in the background. I think my eye was tired now with the phone light. Okay, no big deal, Rogers. Margaret, I show you where I leave data. Okay. So those ones are the normal axis when the heart is beating. From sinoatrial node, internodal, anteroventricular, then it gives way, the right and the left. That is the normal cardiac axis. The normal cardiac axis. And then we have another thing that is very important about the EKG, the P wave. This P wave talks about how the sinus rhythm is being given out from okay, Ridley is saying something here. Let me check. Ridley is saying the piston not moving. Okay, no compression. That one is a mechanical issue, Ridley. No worries. Hi, Ben. Hi, Sis. I see you there. Guys, I will be in the background. Margaret, I show you where I live, Dada. Okay, no problem. So we have said the normal cardiac axis is how the electrical system goes. And then we have the other one, which is the P wave. The P wave is important. Why? Because it tells us a lot on how the blood, the atriums are contracting, forcing blood into the ventricles, of the heart. You see, it is very important. So the tall P waves, right? It shows, Margaret. Yes, I ended it, felt tired either talking to. Okay, now the P wave, this one, if it is tall like this, it shows a right atrial enlargement. It shows this place, this right side of the heart is big. If you look at that EKG and you see it is tall and big, you will see that it shows it's like your atrium are big. The part of your heart that is above is big. This part from here going up, it shows that it is bigger. You get it? So broad notched P waves, large atrial enlargement. Absent P wave, it shows arterial fibrillations, because if this sinoatrial node is producing electricity so fast, it shows that there is a fibrillation, and there is if this P wave, you will not see it. It will be flat like here. It will be flat. So PR interval. What does the PR interval measure? That one we have. PR interval from P to R measures the conduction from the arterioles to the ventricles. From the arterioles to the ventricles. QR complex, that one we have talked about. The SC, the T, all the waves you have talked about them. Evidence of myocardial infarction, I have explained. Now let's have which heart do we use? Let's use this one. Now let's see that if this place or this place is injured, when electrical impulses are coming, it will not pass well. So it maybe this place is dead. So you will see a very tall P wave. Let me bring this closer. You will see a very tall P wave. Yeah, it's a very tall, because from here getting down is QRST. So here in the left bundle there is a problem. And the electricity is not passing through as needed. What will happen? You will see a very tall R, and then it will deviate and go up. You see, those are the essentials when we come to heart conditions. You know, heart conditions are not only diagnosed by blood, as we said, but these are the things that we check when we are going to an EKG. I can see Barry walking exercise in the house when we are coming to an EKG and we check. So because today we have had so many challenges with my network and networks. Duke Momanyi, Duke, this is Kilia with my extra house. Okay, Kilia, I see you. So because we have challenges with the network and the setting, we are going to talk about something that is very important. We are going to talk about something, how to take care of your heart to be healthy. How do we take care of our hearts to be healthy? We have talked so much about so many things. We have we have gone through several things that we have talked about, and now we want to talk about how we can help our hearts to be healthy. A minute. Today I'm having so many challenges from the internet, from how do we take care of our hearts to be healthy. One, the diet. Diet is important. Diet is very important, and it's important when you are taking care of your heart. Okay, before we continue, just a minute, guys. Just a minute. This one was not. Really, blessings to everyone who is still in the chat. Blessings to all. Let me get some light. Yes, like that. So it's important to know how to take care of our hearts. It's important to know how to make our hearts be healthy. Your diet plays a key role in cardiovascular health. What you eat takes a key role. I've given examples of things, and we have been talking about things that we do that makes our hearts and our sometimes how we take things affect our body and the heart. So increased intake of fruits and vegetables, it's very important. Whole grains like oat, brown rice, and whole meat is very important. Lean proteins such as fish, beans, and poultry, nuts and seeds is very important when we are using them. Choose healthy fats like olive oil. Those are the things that we talked about last time. And then we talk about exercising. We talked about it, and we said physical activities strengthens the heart muscles and improves circulation. But you see, there is a question that one of us has asked here, a new person that has asked, Hash Brown 2007, why do athletes have a low blood pressure? You know, when you are an athlete, you are continuously making strenuous exercises. And when you are continuously making strenuous exercises, what happens? Cardiac muscles become so tough. They become so tough, and they start to they start to be strong and thick. So heart muscles that are strong and thick, they are like hypertrophic muscles, the complications that we talked about last time. So when they are hypertrophic, they give you a low impulse because they don't contract normally. So you start getting low pulse rate because they are thick and they are contracting slowly than normal. So those are the reasons why at times athletes have a low pulse rate. If you check a person who have hypertrophic condition in the heart, you will see the blood, the pulse rate is low. So exercise is important. I revisit exercise. Yeah, someone asked a question about exercise. I revisit it. So physical activities strengthen the heart muscles and improve circulation. Aim for at least 150 of moderate exercise per week. Brisk jogging like Barry walking exercise is always giving us tips on how to walk around and do some things, swimming and dancing. Maintain a healthy weight, because a heart that has more cholesterol at the ventricles, it cannot pump blood well. So it means the coronary artery will not give the heart enough oxygen, and it will not give the coronary vessels enough nutrients. Excess weight increases the risk of hypertension, that one we know. Excess weight increases the hypertension risk. That one we know. Diabetes and heart diseases. You remember when I was talking about glaciated red blood cells? Instead of carrying enough oxygen, now they are carrying sugars that you have because you are diabetic. If you are diabetic, you really need to regulate your sugars with the help of a doctor. That is very important. Monitor your body mass index. Monitor your body mass index. You understand your body mass index over height. You understand. Combine balance with regular exercise to stay within a healthy range. Very important. It's very important. The most important thing when it comes to these issues, you need to do what? Avoid smoking and tobacco. Avoid smoking and tobacco. Smoking is a killer thing. Smoking is a killer thing, and avoiding it will help you well so much in life. Smoking damages blood vessels and raises blood pressure. Quitting significantly reduces the risk of heart disease and stroke. You get it? Quitting significantly reduces the risk of heart diseases and stroke. So if you are smoking and you have heart conditions, you are taking yourself to the grave so fast. And you saw smoking gives us the challenge of myocardial infarction, because it can make your heart muscles to start having an infarct. An infarct is a dead place in your heart. Avoid exposure to second-hand smoke as well. Those people are smoking, you avoid being closer to them. Why? Because you will be a passive smoker. You will be smoking as well. So it's important you avoid. Limit alcohol consumption. Limiting alcohol consumption is very important. Excess alcohol can elevate blood pressure and triglycerides. If you drink, do so in moderation. Up to 1 drink per day for women and up to 2 drinks per day for a man. That is 40 plus 40. 1 drink, that means one glass or 1 bottle. But you know, bottles have sizes. So you just, if you can't stay without drinking, stay well without any drink. Manage your stress. Chronic stress contributes to high blood pressure and unhealthy habits. It's important you practice relaxation techniques. Many relaxation techniques like yoga, deep breathing, prayer and mindfulness, it's important. It reduces your stress and it feel better. Engage in hobbies and maintain a positive outlook. If you continue and you are here and you want to have a question, please ask a question as we continue. I can see today we have several people who are new in the house. We have who is this? We have Asumana was here. Asumana, hi. There is a problem of network today. I've changed my way of doing things. I'm using a phone today. Ridley Hash Brown, the new one. If you have not subscribed, please subscribe to the channel as we continue to our talk. Get enough quality sleep. It is very important to sleep, because poor sleep increases the risk of heart diseases. Aim for 7 to 9 hours or sleep per night. Some people say 8 hours, it's okay. Maintain a consistent sleep schedule and reduce screen time before bed. Those people who love watching, you love watching for long hours, you stay in bed watching. Take care about your sleeping pattern. Now, monitor your health regulation is very important. Monitor your health and regulation, the routines that you always have to be checked. Check your blood pressure, ideal below 120/80. That one, blood pressures we have talked about there in the playlist. If you wanna watch them, you can go and see. how they are. Cholesterol levels, we have said, we talked about LDL and HDL. LDL and HDL. It is important to check about your cholesterol levels. We have talked about cholesterol levels. The LDL is the bad cholesterol, and we checked about this is Margaret in Norway smiling upon me. Thanks Margaret in Norway. Yes, we continue. If you have not subscribed and you're watching, please continue and subscribe. Continue to subscribe as we go on. What is cholesterol? You know, cholesterols are very important for your body and even the heart itself. But sometimes the cholesterol of your body can be a bad thing for yourself. And why do we say that? Cholesterol is a waxy substance produced mainly by the liver and obtained from animal food such as meat, eggs, and dairy products. It is transported through bloodstream, and it can go even to the cells to the veins that you have in your body. So take care about the type of cholesterol you have. The first cholesterol that we have is called low density lipoprotein, which is the bad cholesterol. Carries cholesterol from the liver to the body tissues. This is the bad cholesterol. It carries the cholesterol from the liver to the blood tissues. Excess LDL accumulates in arterial walls and forming some plaques. Plaques are things that are hard that cannot move. You get? So these cholesterols, when they are transported in your, what happens when they are transported? Helps protect, you see, increase the risk of heart disease and stroke, because if they make your venules and arteries small, what will happen? You will get the risk of heart disease and you can get a stroke. You get high density lipoprotein, HDL, which is, the first one was low density. The second one that we have is high density lipoprotein, which is the good cholesterol. The good cholesterol transport excess cholesterol back to the liver for removal. HDL, it carries the bad cholesterol and moves it back to the liver for elimination. Helps protect against cardiovascular diseases because it is clearing the bad cholesterol. You get it? So this is one thing that you need to take care, and it will help you when you are taking care of your heart. So you should not take foods that are bringing you bad cholesterol always. Then we have another one which is called very low density lipoprotein. Carries triglycerides rather than cholesterol. Contribute to plaque formation in arteries. You get it? That one is bad. Very bad. It is called very low density lipoprotein. When you are going to do something called cholesterol levels or lipid levels, these are the things that they look at in your body. Triglycerides, type of fats. Triglycerides are types of fats for energy storage. You get it? High level increase the risk of heart diseases, especially when combined with HDL or low density lipoprotein. So we should not always assume these things. Once in a while, rush to a hospital, take your lipid profile, your cholesterol levels, and then we see. Check on blood sugars, monitor to prevent diabetes. Monitor your blood sugars to prevent diabetes. Because you can help yourself earlier before getting to insulin resistance in your body. Body weight, BMI, very important. Take your BMI as needed. Stay hydrated always. Drink enough water. Help maintain proper circulation. And overall, aim for 6 to 8 glasses of water daily. Adjust for climate and activities. It is very important when you are rehydrating. Working with the bottle, and rehydrating means taking fluids, not only water, taking fluids always, soups and so. It really helps when it comes to some problems in your body. Control cholesterol and sugar levels. Sometimes you can have a continuous headache. You are always doing some tests. You are taken to MRIs. You are taken to do this test. You are taken to do this test. The only problem that you find you have is high cholesterol levels. And the more you continue having high cholesterol levels, do you know what happens? You get a condition called arteriosclerosis. Said, hi, Dorothy is here. Hi, Dorothy. We are taking care of our hearts right now. We are taking care of our hearts now. You start having something called arteriosclerotic veins that cannot constrict well. So these are important measures when it comes to taking care of your heart and blood vessels, because your heart is not just your heart. It is linked to your general circulation of your body. You see, it is linked to your general circulation of your body. So take care of your heart and take care of what you are having in you personally. You get it? It is very important to be following up on everything that entails your health status. Now, adopt a healthy habit in daily life. What do we mean by adopting a daily habit in daily life? It means walking. It means walking. Instead of driving when possible, use stairs, elevators. Avoid prolonged sitting. You know, when you are walking, you are helping your body, because your heart is not the only one which is pumping your blood. We have the calf muscles of your legs. When you are walking, the calf muscles of your legs are also pumping blood up and going up and up and up to the heart. So walking helps so much when it comes to exercising. You see, talk to Barry walking exercise and he'll tell you. Know the warning signs. We have talked a lot about how the heart comes, the conditions. I have come to seek doctor's advice before I sleep. Dorothy, okay, welcome. Seek Dorothy. I think, Dorothy, the video that we ran last time helped you so much. You went through it and you learned a lot. So you should know warning signs when it comes to heart diseases. What are the warning signs? What should you do so that you can know there is a problem? Chest pain or pressure is a warning sign. Shortness of breath. You feel that you can't breathe well. That one is a warning sign. Pain in the arms. In the arms, you feel tired in the arms and very neck or jaw. Because you see here, you know, from the heart, the carotid veins, we saw they come and they go to the brain. There is the left jugular vein and the right jugular vein, and beside there is the carotid artery that comes from the heart, and they come and they form the circle of Willis. You saw that? Oh, it's up, and they form the circle of Willis here. So when your blood pressure is so high or your heart is suffering, you start feeling pain at your neck. That is a warning sign. Or a very sharp pain at your jaw. That is a warning sign. Dizziness or fainting. Dizziness or fainting shows that your brain is not getting enough oxygen. So that is a very bad warning sign, and fainting should correctly faster go to a doctor. Excessive sweating or nausea. Excessive sweating or nausea shows that you have deprived yourself oxygen. Now we have healthy eating habits, very important. Avocados, beans and lentils, millet and sorghum, or sweet potatoes, things that are healthy. Junk food and fried foods, we said those ones, we said no. If you are taking things that are junky, you are taking things that have been deep fried, and you know what happens? They have a lot of free fatty acids and radicals. So the chances of you having fatty freaks in your arteries, the chances of you getting cancer, if your family line you have cancer, it is high. So guys, we stop taking a lot of junky things. We stop taking a lot of fried foods that have been recycled cooking fat, because we don't want to get free radicals in our food. Now, let me give a summary of all the things that I've talked about. Balanced diet. I have at least introduced everyone to EKG, how we know something is in your system. There is the echocardiogram, which is an something like an ultrasound that shows how the heart is. If you check it, it will show the veins, it will show how the blood is beating. It is an echo. Echo means sound, so it uses sound vibration to bring out pictures. That is called an echo. So balanced diet lowers cholesterol and blood pressure. Regular exercise strengthens the heart. Healthy weight risk of heart disease. Just see, no smoking prevents damages to your blood vessels. Adequate sleep supports your heart function. Stress management stabilizes blood pressure, because as you are stressed, you saw your blood pressure comes out. Routine checkups enables early detection so that you cannot have further damages. You get? So those are the advices that I'll give you and everyone who is in the house. Now, if anyone has any of questions, can ask. Anyone who has a question, let's talk about exercise. Exercise. Which food should you eat? Yes, food should you eat? We exercise. Just a minute, my guys. Yes, which food should we eat? That is a question from our friend Dorothy K. There are some limitations. Healthy foods common in everywhere. Sukuma wiki, that is called collard greens. I don't know if you have collard greens in your place, Dorothy K. What you have? Avocados, we saw. These ones we talked about yesterday, but I'm just going on faster. And we have millet and sorghum, sweet potatoes. You see, things that I'm talking about are foods that are not junky, foods that have good cholesterol like avocados. And then we have fresh fruits like mangoes, oranges, and bananas. Fish from local sources such as tilapia. Those are things. Dorothy, we talked about these things yesterday, and we really dealt with that in large. So I will refer you to our last topic of yesterday, the video that we did yesterday. You will learn a lot. And let me talk about exercise, because everyone will know about exercise and limitation of exercise too. Because more exercise, you have seen even the athletes get low pulse and they get restrictive functions of the heart. So aerobic exercise, cardio. How many of you do aerobics? I saw my sister going to the. How many of you do aerobics? If you do aerobics, please let me see your hands up. Let me see your hands up. Aerobics, walking, running, cycling, and swimming is just like aerobic. improves the heart and lung function, enhances blood circulation. It is very important to enhance blood circulation, burns calories and aids weight loss. Burns calories and aids weight loss because more carbs are being burned and you are getting good weight. Reduces blood pressure and cholesterol levels. Lower the risk of heart diseases and stroke, because when you are rolling cholesterol in your body, you are removing the fatty plaques that will be on your veins and the fatty streaks that will be on your veins. So it does what? It lowers them. So if you are coming in right now and you have not liked, please like the video. If you have not subscribed, subscribe to the channel and get to know more about health tips. So we go strengthen training, resistance training. You know, there is aerobics and there is strengthening training. You want to weight lift, you want to do all those pull-ups, you want to have strength in your muscle. That one, example like weight lifting, push-ups, resistance band, always builds muscles and strength. Strengthen bones and prevents osteoporosis. Osteoporosis is destruction of your bones, being weak without enough calcium. Improve metabolism, enhances posture and joint stability. That is now for those that are training to be bodybuilders. You see, there is a person who goes to the gym, he wants just to remove excess fats, and there is that person who wants to have muscles. You get it? So that one, it improves you not to get osteoporosis, but maybe it can have a problem when it comes to your heart ventricles because you are pushing them so hard. We go to flexibility exercise, stretching, yoga, those light moods. You get relaxation techniques of your heart, relaxation techniques of your body. Reduces muscle stiffness, prevents injuries, enhances relaxation and posture. That is another one. Tomorrow morning, I will take 400 meters of running. Very nice, Dorothy. That's important. Please take the run. Walk like Barry walking exercise. Barry walking exercise knows it. He knows how to make his life easy. Tai Chi, balanced exercise. Tai Chi and single length stand. Those ones, I know you know karate, you know Tai Chi. Those are types of exercise. If you have not liked the video, guys, please like the video as we continue. Improves coordination and stability. Tai Chi prevents falls, especially in older adults. Strengthen core muscles like the calf muscles, the biceps, the triceps. You see, all those muscles that you need when you are doing your thing. You want to be strong. Effects of exercise to the body. What are the effects of exercise to the body? What are the effects? Because exercise cannot just be exercise. It should have an effect. You see, we get exercise like strengthen the heart muscles, improve circulation and oxygen delivery. It improves circulation and oxygen delivery, reduces the risk of hypertension, stroke, and heart attack. That is in cardiovascular. When we are talking on cardiovascular, we are talking about the heart and the veins and the arteries and the capillaries all and the lymph nodes. Cardiovascular, it improves that. It improves circulation and oxygen delivery, reduces the risk of hypertension, stroke, and heart diseases. Respiratory system, enhances lung capacity in your lungs, enhances how the lungs gets oxygen and reduce. It helps it to maintain its capacity of doing its job of exchanging carbon dioxide and oxygen that you need so that the blood can be pumped to you wherever it is going, carrying oxygen. It improves. This is respiratory system. This is now exercise. We are talking about exercise. Improves oxygen exchange and endurance. You get endurance and oxygen exchange to the lungs. In musculoskeletal, that is now in your bones and muscles. Muscles and bones, increases muscle strength and bone density, reduces joint stiffness and improves mobility. So when you are exercising, you get at least strength. You will not become so weak you can't carry something, you can't do chores in your house. You get it. Metabolic system, it helps improve blood, it helps improve blood sugars, improves insulin sensitivity. And I remember there was a time someone was asking, do exercise help when it comes to diabetes? Exercise is very important when it comes to diabetes, because when you exercise, it helps the isolates of Langerhans and the pancreas to remove more insulin so that you cannot have high sugar levels. So if you don't exercise, the more insulin will not come out. So your pancreas and the isolates of the Langerhans. Exercise is very important. Don't get diabetes. Assists in maintaining a healthy body weight. It assists in maintaining a healthy body weight. You get it. Metabolism, when you cut down the calories, when you are exercising, you feel that you are okay, you are cutting down the fatty plaques. And there is something else, the nervous system. The nervous system is the nerves. The nervous system enhances brain function, memory, and concentration. Enhances brain function, memory, and concentration. Why? Because when the nerves are excited, they keep on creating some things called the dendrites, and when the dendrites are growing, they create something called the neurotransmitters come up effectively. So when they come up effectively, your nervous system becomes strong. Improves coordination and reaction time. Coordination. Have you ever met someone who is very slow? In life, you meet just someone who is very slow, and coordinating is very... If you work with that kind of person, my friend, you will be tired. If you work with that kind of person, my friend, you will be tired. Slow people, they are always... You are at work, you need to think fast, you need to do something, and this person very slow. You get tired, you see. So in the nervous system, exercise is very important, but there is something called the mental health part. The mental health part reduces stress, anxiety, and depression. Self-esteem and mood through endorphins release. When you are exercising, you remember there are some hormones that you release, like the endorphins that make your body feel naturally stable and relaxed. Improves sleep quality. And then immune system. In the immune system, strengthens the body ability to fight infection, reduce chronic inflammation. Reduce chronic inflammation. So let's see. Continue asking questions about taking care of our hearts, and taking care of everything about our health. So anyone with any question? Let's see anyone with any question as we continue talking about our health benefits. Anyone with any question? As we talk about exercise, there are limits of exercising. Target heart rate of 50 to 85. Norway, Margaret in Norway, Maggie, thanks a lot for your heart. Target 50 to 85% of your maximum heart rate. 50 to 85%. Maximum heart rate is equals to 220. Imagine your heart can beat up to 220 times and you are still alive. So the heart rate target about 50 to 85% of 220. You don't go beyond that, because you may blow up your heart, and then you get a clot. Daily steps should be 7,000 to 10,000 steps a day for those who like walking, like Barry walking exercise. Strengthen training. Allow 48 hours of rest between sessions of the same muscle group. You get it? If you are a bodybuilder, allow 48 hours of rest. If you are a runner, 48 hours of rest. Don't overdo. Drink adequate water before, during, and after exercise. So it means once a day exercise, because a day is day and night. Once a day exercise. Warm up down 5 to 10 minutes early. Signs that you exceed limit. Some people can do exercise until they are tired and they are still pushing and pushing. Then you start to feel chest pain or triggers, tightness. Stop exercising. Severe shortness of breath. Stop exercising. Dizziness or fainting in the gym or when you are walking, stop and relax. You are hearing palpitations from your heart, stop. Extreme fatigue, joint or muscle pain, you stop. Don't exceed, because you know when you are tired, there is something called lactic acid that has piled in your muscles. So when you continue working out, you are still giving your muscles aerobic respiration. Benjamin, I'm busy, but join the live. Thanks a lot. Savior man, thanks a lot, Savior man. So when you're still giving your muscles that pressure, you are doing what? You are giving your muscles pain, and they may die off slowly. And for the bodybuilders, it is important that you don't rupture your muscles by carrying heavy weights, because you will not exercise again. So carry the weight that you can carry within the limit. Don't exceed. Graduate slowly to the next weight. So my summary on exercise is for cardio, improves heart health. For cardios, 150 to 300 minutes per week. That is minutes, that is 6 times 5, that is 3 hours of. For cardios, you have to do like 3 hours of cardio. For strengthen training, bodybuilding muscles, and you want to be strong with muscles, 2 to 3 days per week. Don't exceed 2 to 3 days per week, because aerobic respirations in your muscles can destroy your muscles, because you are producing more lactic acid. Flexibility enhances mobility daily, or at least 3 days. Walking, you can walk daily. We need to walk daily. And balance, present force like Tai Chi, all those. Walk daily. Do this exercise. Exercise is a very important thing in life. It's very important when you are exercising. It's very important. So we have talked a lot about the heart conditions. We have talked about very many things about the heart, and people have learned that there are some things that we started by knowing the diseases. We started by knowing how we can. So there is, Benjamin, what's the topic? The topic today has been random because I had a problem with network, and we are dealing with how to take our health, the heart health at par. We are dealing with how to, doctor, I drink beetroot juice daily, walk 10,000 steps a day at work, and on earth beetroot. What's your thought? That is a very good way of doing things, Queen B, and that's why you look younger. That is why you are looking younger and younger and younger. Queen B, continue with that spirit. Drink, let me see. Somebody asked fruits and fluid. There are some fruits that, and fruits. There are some drinks and fruits. Good evening, doctor and all. I can see Stan's Kitchen. Stan's Kitchen, you are so kind. Thanks. Stan's Kitchen, yesterday your phone let you down. We wanted to talk to you with Jamaican uncle, but everything, I think on Sunday it will be okay, so that we interact and we talk to you and we feel nice. Now, I think this part goes to Dorothy K. There that are beneficial to the heart health. There are some fluids beneficial to heart health, and these fluids are like green tea, rich in antioxidant called catechins. You see, they help to reduce the low density lipoprotein, the green tea. And then we have pomegranate juice. It reduces the fatty plaques in your arteries. And as it does this, it reduces blood pressure, enhances blood flow, so that your brain can get enough oxygen and the heart muscles for you to have a healthy heart. We will have another opportunity, doctor. Thank you for your concern. Yes, on Sunday we will have another session like that. Don't worry, everything will be okay. High in beetroot juice. Now, Queen CNLB, listen to that. Beetroot juice high in nitrates and helps relax blood vessels. In nitrates, improves oxygen delivery, supports health in your blood pressure. So Queen B, continue with that spirit. That is the spirit that you have. If you are coming in now and you have not liked the video, please like, and if you are a new subscriber, please subscribe and tell me I'm a new subscriber. So Queen B with beetroot at par. Continue with the spirit. Continue helping your body to have that good vibe of delivering oxygen to the tissues and helping your heart to pump blood so well. We have hibiscus tea. Help reduce hypertension. Hibiscus, rich in antioxidants. You see, most of the green teas and the fluids that are coming naturally, they are coming up with something called antioxidants. And there is a video that we did, and this video was saying there is a difference between antioxidants and detoxification. What we do to our body is we take antioxidants to clean up the oxidants. There is nothing like detoxification. There is nothing like detoxification. You see that? Detoxification is another process that the liver does. Benjamin, your live stream doesn't have super chat and sign. Yes, because I'm not yet there, Savior Man. I'm not there, but it will come soon. Very soon you will see it. Very soon you will see it. Yeah, you will see it very soon. Yes, Fulia. Stan Kitchen. Fulia. Yes, so you see, antioxidants, they remove the oxidants that will destroy your cells. And as you see, these fluids that I'm talking about, most of them are what? This is Donna Douglas. Donna Douglas, hi. Today you made it to my chat. Welcome, Donna Douglas. We wanted to see you yesterday and talk to you, but you I think you said you can't. But on Sunday, I think we will. We are taking good care of our hearts today, and we are knowing the fluids to take. So welcome to the chat, and like the chat and share also. So we said, Benjamin, you aren't monetized yet. Yes, I'm not. I started just yesterday, Savior Man. Soon I will be, but I'm taking my time. So don't worry, Savior Man. No worries. Time is coming when everything is possible. Then everything comes up. Now we continue. We said hibiscus tea helps to reduce hypertension, rich in antioxidants, supports cholesterol control. When you hear about support cholesterol control, we are talking about it is clearing the fatty plaques from your veins and the heart. We don't want the bad cholesterol like the low density lipoprotein, and we don't want the bad cholesterol. So slowly but surely, this channel will get a cup love throughout our continuous share and subscription. Stan Kitchen, thank you so much. Thank you so much for your compliment. I appreciate that. Water. When you're taking water to your body, benefits: maintains volume and circulation, prevents dehydration and strains of your heart. You get it? It's dehydration. Your body needs water to do metabolism. So when you are dehydrated, I always think you are monitored to receive super chat. No, I'm not yet. I think, Savior Man, you want to surprise me with a super chat. You have really insisted on that. No worries, brother. It is coming. So anything that is happening in your body, I talked about how things are removed from your body. I talked about the liver. Before anything is released from your body, there is a process called detoxification. That kind of you, Savior Man. God bless you. Savior Man is my friend. Savior Man, when are you coming to Kenya, or when are we meeting somewhere? We will meet soon. I really need to meet Savior Man. Now, when you have eaten food or drunk a substance, it goes to your bloodstream. It goes up to your liver. When it goes up, I was going to super chat you, but I can't. So sad. No worries, Savior Man. So when it goes to your liver, what happens is this. The liver changes the fat soluble thing, because for you to carry something from your stomach to the liver through the bloodstream, that thing has to dissolve in protein, and then from the protein soluble, it has to go to the blood, because the blood itself is protein content. I'm talking now as a layman. You understand? I'm talking now as a layman so that people can understand. So when it is lipid protein, now I'm talking like lipid soluble, the cholesterols. If it has dissolved in cholesterols, it is carried up to the liver. Then the liver itself, what does the liver do? It changes that thing from lipid soluble, the solubility of proteins and cholesterols, to water soluble. Now that is the process that we call detox. The liver detoxing something. How are you, Margaret? Savior Man is saying hi. So when it changes from lipid soluble to water soluble, some cells in the liver destroys the bad things that you have that can disturb you. Then the water soluble now is carried, and that's how in the bloodstream you start having, you go to urinate and you pass poop. You get it? The contents that are from your stomach that have gone to the liver, they are changed to water soluble so that they can be broken down to things that you can eliminate through your kidney by going as urine, and then you urinate. You get? So that is the process of detoxification, and water is the most important thing when it comes to this process. So if you don't like taking water, you are not doing something good to yourself. Let's take water, my friends. Let's take water. Prevent dehydration and strain of the heart. Let's have enough volume of blood to ourselves, because when you take, the blood itself is increased. Now we have healthy fruits. Margaret, your channel is growing so fast. Jamaican uncle is working day and night for all and support. Yes, very true. You can see Christine Long, welcome to the channel. I can see you here. I can see here previously you had a problem, but we have picked up and we are going and going and going. There are some fruits that you should take to help your heart and reduce the cholesterol that you have in your body. I'm good, Stan. And what about you? Stan. Yeah, that's it. Now, apples. I'm still talking about the apples. An apple a day. Hello, Doc, and everyone in the chat. Christine Long, we are good. We were just waiting for you to see your smile and to see the lovely face of yours, and then we get your like and we interact and we feel nice and we go and relax. You know, when you feel you see your friends, someone feels nice that the friend is around, and you feel you are contented. You see? Yes, Christine Long, Margaret, congratulations. Keep on pushing. Yes, Margaret, keep on pushing until we are there, 1 million subscriber. Margaret, thanks for your pushing and loving content that you usually put up for us. Now, we have rich foods in soluble and fiber. Apples. An apple a day. You stay away from Dr. Ben's office. Absolutely. Some people prefer to drink soda and liquor. So when you take an apple a day, yes, Savior Man, thank you for all your support. The fibers in apples, they are called pectin. They help to lower cholesterol levels in your system. Now you know why we say an apple a day makes you stay away from the doctor. Those fibers that you are eating, those fibers that you are eating from the apple, they are the ones which are helping you to stay away from the doctor's office. Why? Because they brush off and they pick the bad cholesterol from your system and they destroy them and they are taken away. You see that? That is why it is important you take an apple a day for you to get those fibers that are called pectin. We have avocados. Benefits of avocados. Who doesn't like avocado in the chat? If you don't like avocado, say hi. Or if you've eaten avocado. Margaret in Norway, tell them we were eating avocado and we placed them in githeri. Githeri is a mixture of beans and maize. Greetings, Miriam Mumbwa. Welcome to the chat. Say hi. Give me a like and we continue. Margaret, I think with 500 subscribers and 3,000 now, you can get monetized. I saw channels less than 1K and already monetized. Oh, okay. No, those ones are channels that Savior Man, they started far back when they had a channel before, and now they monetize currently. You get? Now we continue. That was a Passover. Margaret, I was talking to Margaret. Tell them about the githeri and avocado, and then we sing to them the song of avocado from Janine. You see, when you take maize with beans with avocado, what are you doing? You are helping yourself. The beans themselves have protein content. The maize themselves have fibers to make you don't have constipation. And the avocado, the fruit itself, just listen about avocado. If you don't like avocado, please tell me. I hope soon I'll get there. So nice. High in health, mono unsaturated fats. Avocado I've got the watch hours, but only 80 subscribers. Oh, okay. I can see. High healthy mono unsaturated fats. And what do these do? What they do, they clear the bad cholesterol. They clear the bad cholesterol from your system. They clear the bad cholesterol from your system. You see that? They clear the bad cholesterol. Oh, okay. Savior Man, I didn't know that. And very soon, even mine will be monetized. No worries, no worries, no worries, Savior Man, no worries. Time is coming. Avocados are very healthy. Yes. Margaret, tell them we here in Kenya we take it with githeri and we feel strong. So the avocado it is healthy with unsaturated fat, monosaturated. So mono, it carries the bad plaques in your arteries. It is like the high density lipoprotein that we talked about. So it takes the bad cholesterol from your body and clears it up. It clears the bad cholesterol in your body as you best blue band for Africa. No, that is Miriam Mubwa. That is our blue band. We take avocado even in bread. Even in bread. If you don't have blue band, you use avocados, right? Good. You see, Miriam Mumba is giving us an insight of using avocados. Now, we continue like there are other fruits that we can take. So I've said for avocados, they have monosaturated fats that they help clear the bad cholesterol, the LDL. So avocados are naturally like the HDL, high density lipoprotein, that the body produces to help your body. So man, why go buy margarine? Why go buy blue band? Avocado is the saying of the town. Miriam, is that true? Right half to one case. Savior Man really wants to know about subscriptions. Yes, please, those who are subscribed, help about monetization. Those who are monetized, please help Savior Man to understand. You know, let me talk about it, Savior Man. When you reach 1,000 subscriber plus 3,000 hours, you can be super chatted, but you are not monetized. Monetization comes when you reach 4,000 hours and you have regular people that are coming to your channel, so that you can get what? You can get some adverts, you can get so. But if you have not reached 3,000 hours plus like 500 subscription, you cannot be super chatted. But you should be creating at least in a week 3 videos in your platform, Savior Man. You get it? You cannot say that you have monetized and you're not giving videos. You should be giving at least videos a week so that you can have money. It's not even monetized. It is appreciation from the people that are watching you. Savior Man, monetization is when you have 1,000 subscribers and also you have 4,000 watch hours. But when you are in the US and some regions, you can be monetized even with 500 subscribers. You see, Miriam and Savior Man, it depends with the region that you are. Let's continue with our topic, berries. Berries. Example are strawberries, blueberries, raspberries. Those are the types of berries that we know. The berries that we know, packed with antioxidants. They take the free radicals that are destroying your cells and they destroy them and remove them from your body. You get it? Reduce inflammation and oxidative state. They reduce inflammation and its oxidative state. In the US, you can be monetized and 3,000 hours. Yes, Savior Man, that is true. Yes. So when you take berries, if you are coming in right now, like the chat as we continue, to learn. Good for good sight. Yes, good for good. Carotene. When you are taking carotene, vitamin A, you know carrot has a lot of vitamin until it was called A-carotene. We will see about that. Reduce inflammation. So berries help in reducing inflammation and inflammatory state. So take them. But we have our good person here, our good something called the bananas rich in potassium. Helps regulate blood pressure and heart rhythm. We have Pammy Diaries. Good job, dog. Pammy Diaries in the house. Please hit the like button. And if this is the first day that you are coming here, I like. Tap tap. Tap tap. I've seen Miriam Mumbo is giving me a carrot. Miriam Mumbo wants me. Benjamin, Miriam also said also in Kenya. I don't know more about monetization, Savior Man. I just do videos. When I'll be monetized, I'll know. The people who know mostly about monetization, I know they can help me when I reach there. So let me just flow. Let me just help the people to live well. Yes, Savior Man. Time is coming when I'll be monetized. So let's continue, my friends. Let's continue. This is for the information to my friend. This is information that will help everyone. So if you are in my channel, feel free for any help, for any and anything. Miriam, once you got monetized, can you receive super chat as soon as? Okay. Savior Man is still on monetization. Let's continue. Helps regulate blood pressure and heart rhythm. You know, bananas have got potassium, and potassium is vital for your heart. It helps maintain the rhythm and heart rate. So if when you have a low potassium, your heart rate becomes so bad. Sometimes you can have tachycardias, high heart rates, or bradycardias, low heart rate, depending with which condition you have. So my people, take potassium, take bananas. Bananas are good. If you have not liked the video, my friend, please like the video. Which fruits are friendly to the heart? These are Kingre. These fruits that I'm talking about, these ones are the ones. Imagine like avocado, which is getting away the bad cholesterol. You see, say, Benjamin, you are at work, you need to get paid. Savior Man, don't start me now. Okay, I see you, Savior. Savior Man always finds something to strike me up. So I was telling Kingre, if something is clearing your bad cholesterol from the body, making your veins and arteries to be good, it means that this thing is helping you. It is helping you to clear your system so that your heart rate and your heart condition can be nice. Apples, pectin. If the apples are clearing the bad cholesterol, it means it is helping your heart. You get it? You see, berries are antioxidants, and what are they doing? They are destroying the free radicals in your body. If they are destroying the free radicals in your body, what are they doing? They are keeping you away from cancer and myocardial infarction of the heart. You see that? Very important. It is very important for you to follow these berries and bananas. So we are J. Kingre Judy. I'll start calling you Judy. Judy, when you hear me calling Judy, say that you know that I'm calling. Miriam will super chat you next time for sure. Okay. Judy, what I'm saying is bananas help to maintain the rhythm. You see, all these fruits are important. Oranges, imagine, high in vitamin C and fiber. Supports health brand. I knew apples and pawpaws. Now, you have brought in another fruit which is so important, Judy. Pawpaw. Pawpaw is so important. Before I finish, I'll talk about pawpaw and then what time do I have? Oh, we still have some time. Let me see. Okay, we still have some time. I'll talk about pawpaw and the liver. It is a very important thing to the liver. If If you are coming in right now, the likes, let the likes, like, I'm Naliaho, I am Naliaho is here. Wow, I'm Naliaho. Thanks for tuning in. Benjamin the Wise Guy. I'll talk about pawpaw and the liver. Now, we have talked about pomegranates. Pomegranates improve circulation and reduce arterial stiffness. Hello everyone. Hello Dr. Benjamin. Welcome. Please guys support and show love to our sister Miriam too. Very important. And the YouTube channel, Miriam has clicked the like that link. Miriam, support our sister Miriam there too. Now, pomegranates improve circulation and reduce arterial stiffness. You get it? It improves arterial stiffness. Grapes contain resveratrol, and you know resveratrol is like a statin. Yes, I'll talk about papaya. Before I finish, I want to talk about papaya and the liver. Very important. You see, resveratrol is a statin which controls the clearance of bad cholesterol in yours. So when you take grapes, just know it is helping you with this resveratrol. Helps reduce inflammation everywhere, even in the heart. It's very important. It is a very important thing to be taking. Papayas. Now we are at papayas. What is a papaya? Here we call it pawpaw. Here we call it pawpaw. And some people call it papaya. Like I see Donna Douglas is asking if I'm talking about papayas. So papayas contain antioxidants, and these antioxidants are the ones that help us. They got vitamin A and C, supports the blood circulation. But you see, papaya is a nutrient-rich tropical fruit, but it's everywhere nowadays. This fruit, they contain vitamin C, protects liver cells and oxidative damage. You know, when sometimes you are taking, when you are, Benjamin, let me read this one. Savioman is asking, Benjamin, which one is good, the fruit itself or the juice? You take the fruit and the juice, everything there. If you want to blend it, drink the juice. Yeah, everything to go. The juice is the fruit is the juice. But most of the ingredients are in the juice. So if you take the fruit, you want the fiber, take it. If you want the juice, take it. You get it? So you see, we are talking about the pawpaw. For those who are coming in right now, remember to hit the like button and subscription too. Raw ingredients are best. Very true, Christine Long. Raw ingredients are best. So vitamin C protects liver cells and oxidative damage. When the cells of your liver are metabolizing and changing things to water-soluble things, what they do, they undergo oxidative damage. So vitamin C helps to reduce the oxidative damage, so your cells does not die. At not even juice is juice. Savior man, come on man. Take the pawpaw itself, dip it into the blender, screw that thing, put it in your glass and drink. You've drank the juice from the pawpaw and you have taken the pawpaw itself. What else do you want me to say, Savior man? Savior man, you gotta be funny. Okay, vitamin A, beta carotene, the one that you get in carrots. Good in vision. You get it. Try to get organic fruits are the best. So that is so true, Donna Douglas. So true. Beta carotene, the one you felt in carotene, is also in carrots. It's also found in vitamin C. Supports tissue repair and regeneration. You see, it supports tissue repair and regeneration. Folate, vitamin B9. Imagine, aids in detoxification of cell metabolism. You know, when the cells are working so much, you are giving them so bad foods, they want to break these foods into lipid soluble to water soluble, and you are continuously, they die off because of oxidation. So folate vitamin B9 helps the cells not to die and the new ones to generate, the liver cells. I'm talking about the liver cells, so that they can continue. You know, when the liver cells die, they start creating fatty tissues in the liver. And when the fatty tissues are created in the liver, that is the first step of cancer of the liver. Now, don't get worried. We are starting to grow. Hit the like button, tap on your skin. Benjamin, organic fruits are so expensive in the US, not like Africa. It's also free or affordable. In Africa, sometimes you don't even buy. You walk in the shamba and you eat and you go home. In the villages, you just walk into someone's home, you tell him, I feel like taking this fruit. You eat and go home. Sometimes a place like the eastern part of Kenya, when the fruits are so many, the mangoes, you don't need to buy. Africa is blessed with organism, organic food. So if you are coming in right now, my friends, this is Benjamin the Wise Guy. We talk here about medical issues, medically help each other on dealing with some specific issues about health and even mental health. I thank everyone that has been here as we continue talking. This is CJ Rehab. Hello, doctor. I am fine, CJ Rehab. If you have a question, feel free to ask. Don't put it on yourself. Feel free to ask the question that you have as we continue talking, and you continue giving me those likes that you are giving me. Now, we have fiber. We are talking about the pawpaw, remember? We are talking about the pawpaw. The pawpaw has got fiber itself. The fiber that Savior Man doesn't want to eat. Savior Man wants to drink the juice. Savior Man wants to drink the juice, not the fiber. You know, the fiber, when you take the fruit plus the fibers themselves, helps eliminate toxins and reduce fat accumulation through the gut. So it's good to eat the fruit itself. Savior Man, you hear that? Benjamin, when I get to Kenya, I'll get my papaya and guava on the tree. You will find them so many, Savior Man. Here in Kenya, this is a tropics. Eat the seeds too. Savior Man, if you eat a lot of guavas, you'll get constipation. What about eating the pawpaw seeds? No problem. You eat them. They have no bad thing. They are antioxidants. You eat them. It's the pawpaw itself. But some people don't like them because they are bitter. You know, seeds are bitter. So, Savior Man, when you come to Kenya, the first thing, eat a lot of guavas, get constipation, clear your gut, although it will be so tricky for you, but we thank you because you will be clearing your gut and you will be feeling it through. Now, potassium. Even the pawpaw has potassium, just like the fruit that we're talking about, which is the fruit that we are talking about, which is the what? The mangoes, the banana itself. So you see how the pawpaw has a lot of. Benjamin, you mean guava is not good? It is good. Some people eat a lot of guavas until they get constipation. You get? They eat a lot until they get constipation. But when you eat the required levels, you can't get constipation. You cannot get constipation. So potassium maintains fluid balance and metabolic function, and also helps the heart in the beating process. You understand? Antioxidants reduces inflammation and cellular injury. Now, here, which fruits are best for eye? Hey, the pawpaw, anything that has. This is Doc. Talk about too much carrots and liver during pregnancy. Oh, okay. Carrots and okay, I'll talk about that. Okay, which fruits are best for the eye health? Now, that one is any fruit that has beta carotene in it, and you see papaya has beta carotene. We have talked about papaya. We have the carrot itself. We have something called rods in your eyes and opsin that helps when you come to beta carotene. You always hear about people talk about what? Eat a lot of carrots so that you can get good sight. It is important because good sight is for beta carotene. Now let's continue about mangoes. Mangoes, I'll finish with them. Papayas I've really talked about. Rich in oxidants A and C, support health and blood circulation. But there is a question that which for eye health. Let me answer Christine Long. No, we start with the first one, which is talk about too much carrots and liver during pregnancy. Okay, I'm talking about that right now. Right now, if you are coming in right now, please don't fail to give me a like. Don't fail to give me a like. Give me a like. Let me feel like I'm trying to help some people. Let me feel like I'm trying to help people here. Okay. That's it. Let me place this one here. Doc, check my question above. Yes, that is Pamela Pami Diaries. Okay, Pami Diaries have asked about carrots. The question says, let me read the question. Doc, talk about too much carrots and liver during pregnancy. You know, when you are pregnant, your liver is doing a lot of work, because it has bypassed the umbilical cords and it is serving the child in the stomach. Thanks a lot for those likes. Thanks a lot for those likes. And if you're coming in right now, give me a stricken like and a subscription too. Don't fail to give me a subscription, because when I come live again, you will need to see me live. So let's continue. Let's have 30 likes, 40 likes, and continue. So we start with pregnancy. During pregnancy, doctors caution consuming excessive amounts of carrots. You imagine, we caution that. What broccoli and spinach good for? Let me answer this first. It's very important. Amount of carrots and the liver, because they contain high levels of vitamin A, which can be harmful to the baby developing, because the umbilical veins have bypassed through the liver. You get it? So it is going direct to the baby. While vitamin A is essential for the fetal growth, too much of it, especially is performed from, can lead to complications. Now, why too much carrots and the liver can be risky? Let's talk about why too much carrots and the liver can be risky. Why can too much carrot? Vitamin A exists in two main forms. One is retinol and the other one is Betty C is here. Betty, welcome to the platform. One, it contains retinol and the other one is containing carotene. So retinol is vitamin A, and provitamin B or provitamin A is beta carotene. So where do we get vitamin A? Retinol. Here is where we get in liver, fish oils, and dairy products can be toxic in excess. So the toxic part of the vitamin A is retinol. The retinol is the toxic part, which is found in liver, fish, liver oils, and dairy products. You get it? And in pregnancy, can be toxic in excess. You get it? But there is another one. This question was coming from Pami Diaries. I want you to listen to the Pami Diaries very cool and nicely. This one. Welcome, Christine and Betty. Hi, Benjamin. Welcome to the platform, everyone. When you're coming in, like, and continue subscribing. So I was saying that two ways. Vitamin A comes in two ways. One is retinol, two is beta carotene. So sources of vitamin A retinol is liver, fish oils, and dairy products, and those ones are toxic in excess. So the better ones are these ones: carrots, pumpkins, mangoes, and sweet potatoes, generally safe. So in simple, what we are talking about is, we are talking about retinols that are vitamin A found in animal products and aquatic products are not good in excess for a pregnant mother. But those ones that are found in plants, like carotene, pumpkins, mangoes, sweet potatoes, are generally safe. So listen to this. Liver contains very high levels of retinol, which accumulates in the body and cause toxicity. You get it? Carrots contain beta carotene, which the body converts into vitamin A only as needed. You know, the body checks. So when you take plant carotenes, the body it's not active when you take them, but it changes it when it's needed. Excess intake may cause harmless skin discoloration, but is usually not dangerous. You get it? Doc, talk on carrots and liver during pregnancy. That is what I'm talking about. Pami Diaries, I'm talking about during pregnancy. That is what I'm talking. Just follow. So the risk that is there when you are taking a lot of animal products that are producing retinol. I've said they are producing two types. We have retinol and beta carotene. You remember, retinol, vitamin A, and beta carotene, which is found in normal plants carotene. So there are some defects when you can find in pregnancy when you are taking a lot of carotene that is found in animals. And we have said from liver, fish oil, and dairy products a lot. These are defects that you can find because a lot of it can be toxic to something called embryology. When the baby, when conception happens, the forming of the baby can be disrupted by these retinols, because now they are high. They kind of like stop some processes in embryology, in the forming of the baby. So this baby can be born with the brain and spinal cord that are not okay. The heart, you remember the heart problems that we talked about, tetralogy of Fallot. You remember the heart conditions that we are talking about, congenital heart diseases that we are talking about. The one that we were talking about, cyanotic and acyanotic. Pami Diaries, check that out. You will see. There's somewhere we talked about heart conditions. The face and the skull, the eye and the ears, because when these beta carotenes have affected a place of innervation when the baby is forming, if it is the spinal cord, it has bound there. That spinal cord will not come out well. You know, life starts from conception. When the conception has started, you see, when conception has started, whatever you take can harm that baby. And that's why you are told, don't take this drug, don't take this. You get it? Pamidaris, I hope right now you are loading, and that's why I started by saying vitamin A comes into two ways: retinol and carotene. Retinol are the ones that are found in animal products, liver, fish oil, and dairy products. Provita A, Cassandra Queen is in the house. Thank you for loading in. Is carrot, pumpkins, mangoes, and sweet? Benjamin, what can cause a stroke or heart attack? Savior man, I've talked about stroke for so long, but don't worry, I'll answer you that. So, when you are taking a lot, the plant product, the animal products, the carotene itself, the retinol itself binds to the cells that are producing the baby, and there is a process called the meiosis, mitosis, that goes on when you are conceiving a baby. So the retinols bind into that process and they disrupt that process. So you find that instead the head of coming out well, it is coming out as something else. And that here is where we get birth defects like congenital heart diseases and the spinal bifidus. Sometimes even the genetic issues like autism come out here. The ear and the eyes. You get it? This condition is linked to hypervitaminosis A, when you are taking a lot of vitamins and you are pregnant, and may result in serious fetal malformation if intake is excessively. So you are not told not to take, you are told not to take excessively. You get it? I hope our friend Pamidaris is still here and listening. Pamidaris, are you still there? So Recommended Daily Diaries in Pregnancy, Vitamin A. I would advise women that are pregnant. Yes, I'll advise, thank you so much for being here, Pamidaris. I would advise women that are pregnant, when you are pregnant, don't take a lot of animal products, fish oils and liver. You get it? Take beta-carotene vitamin A. Beta-carotene means plant products. Products like carrots, pumpkins, mangoes, and sweet potatoes. You get it? They are generally safe. Although when you take a lot of carrots, you know what can happen? You can get a hypopigmentation in your skin, the plant products, but it doesn't mean it's bad. It is okay. It goes away with time because it interferes with your skin. Benjamin, can you make herbal medication product in Kenya like Juiceman? There are some people who, Savior Man, there are some people who make them, but me, I cannot because I'm a registered doctor. Those ones are called herbalists. They are registered under Ministry of Heritage, of Ancestral things. You get it? We have to preserve so you go to the Ministry of Heritage and you get a license so that you can do that. You cannot just start doing herbals when you don't have a license. Now, I will recommend when you're taking vitamin A, you take plant products and vitamin 770 micrograms, 3,000 micrograms in a day. Not so many. Exceeding the upper limit, especially through the liver or supplement, can increase the risk of complications. So don't take supplements of carotenes when you are pregnant. You know, some people take carotene when they are pregnant. Benjamin, can you make herbal medicine? That one I've answered. Don't take supplements of carotene when you are pregnant, especially the retinol. Carotene, I've said, comes, I need help. My mom has a knee pain. What can she use? Kindly advise. Knee pain. How old is your mother? And is she arthritis positive? Or does she have gout that is known? If she has gout that is known, please let me know. It is important. I can help there. But mostly we use anti-inflammatories. Anti-inflammatories are best for knee pain. You give paracetamol. If it's an adult, you give 1 gram. Those are 2 tablets daily for like 3 days, in the morning and in the evening. Cassandra Queen, I think you are listening and noting down. And then you buy something called prednisolone, the blue one, not prednisone, the white one. For quick recovery, you give prednisone. Prednisone, it works as an inflammatory, but it's a steroid. So you give 50. You start with the first day, you give 20 milligrams plus once a day. So if your mother has taken paracetamol in the morning, 2 in the evening, you will give prednisone 4 tablets. If it is 5 milligrams plus 2 of prednisolone. A knee pain can get through surgery easily in US. And then the prednisone should go once a day, 4 tablets, 20 milligrams for 3 days, and then you reduce to 10 milligrams for 2 days, and then you reduce to 5 milligrams for 2 days. The pain will have gone. But for paracetamol, you give it for 3 days, morning and evening, morning and evening. That one will help to check the knee pain. But make sure that your mother has gone to a hospital, has been checked if she has gout arthritis or uric acid elevations. Let's go, guys. If you are coming in, you are new, subscribe and like the video. Now, we were talking about, let me see what's the time. Okay, we were talking about safe guidelines. Liver. What can we do to the liver? Safe guidelines of the liver. Now, because we have seen the liver contains beta carotene, what can we do to the liver? I think that answering it so nice. I'm answering it so nice. Safe guidelines. Avoid frequent consumption during pregnancy. Wait a minute. Okay. If consumed, limit to small portions once in a while. Those are the carotenes, retinols that come from animals and aquatic, like fish. Many guidelines recommend avoiding it altogether, but you can take small portions. But me, I think avoiding is the best rather than taking chances. So if you are pregnant, avoid. Carrots safe when eaten in moderation as part of balanced diet, because that is a plant. So you can, if you are pregnant, you can take carrot, but don't do excessively. It may cause yellow-orange skin discoloration on your skin. You get? Why is vitamin A? Why vitamin A is really important? Benjamin, our body is our temple. Okay. Fetal growth and development, vision and immunity, skin and organ formation. I think for that question, I've done my best. PAMI diaries. Now you know what to limit and what not to limit. There was another question from, let me find, which fruits are best for the eyes? That was from Christine Long. Christine Long, which fruits are best for our eyes? Now, this is your question. Oranges, lemons, and grapes are rich in vitamin C, protects against cataracts and macular degeneration. You know, cataracts that happens, you go to surgery and then they are eliminated. Strengthen blood vessels in the eyes, reduce oxidative stress, because we saw vitamin C reduces oxidative stress. Mangoes, I hope Christine Long is here listening. Christine, this is your question. We are about to finish. If anyone else has a question, you can put it through. If anyone else have a question, you can put it through. Benjamin, there are many types of grapes. Which one is the best? Grapes are best. Let me answer. Grapes are grapes. They produce the same, but what about vitamin D? Okay, I'll answer those. I think let me answer the one that was asked previously. Now, protect against cataracts and macular degeneration, strengthens blood vessels in the eyes, and reduces oxidative stress. Vitamin C, that is found in Citrus fruits. If you have acidity, don't take citrus fruits a lot. You will injure your stomach and you will feel so much pain. Mangoes, vitamin A and beta carotene. So mangoes are good for the eye. When you hear about beta carotene, you know it is the carotene that is best for you. Improves night vision, prevents dryness, and supports the cornea. Blueberries. Blueberries, that is blueberries are good because they contain antioxidants and anthocyanins. Anthocyanins, they are good for the eyes, protect the retina for damage, improves blood circulation, reduces fatigue to everyone, and prolongs screen use. Like me, I'm always on the screen, Savior Man, all the YouTubers. Pineapples, they have vitamin C. We have said it is an antioxidant best for the eye. Avocados, lutein and zeaxanthin. They contain, avocados fight harmful blue lights. You get it? Reduce the risk of age-related macular degeneration. So avocados help they help the fibers of your muscles not to they help the fibers of the muscles not to degenerate. Supports overall vision. Now, bananas, they contain vitamin A and potassium, help prevent eye syndrome, support proper nerve function in the eye. Strawberries also contain vitamin C. Watermelons, they contain lycopene. Lycopene protects against oxidative state. That is a question that has come to one of us, and I've answered it. He knows the fruits that she can be taking. Now, Savior Man has asked, Benjamin, there are many types of grapes. Which one is the best? Savior Man, yogurt is milk. All those of milk that you know they are branded with some things are milk, but you know about grapes, when you talk about grapes and which one is best, grapes are known to produce wine. So it is graded by the wine seller as how it can produce the wine. But I know the red grape is the best grape that you can ever have. You know why? The red grape, best for heart health. It contains antioxidants and something called lavestrol, which helps to reduce the cholesterols of the heart. You get it? The bad cholesterol that can destroy the heart. There is the black grape, best for immunity and anti-aging. But you see, even if you go back to the red grape, it still have the same aspect that the black grape has. We have the green grapes also, which has vitamin C and vitamin K. You get? And we have the Concord grape. The Concord grape also has antioxidants. But all these grapes are doing the same thing. Like, but me, I prefer the red grape because it has got an antioxidant and lavestrol, which clears the blood cholesterols. You get it? So me, I prefer the red black. But for a person with immunity issues, you can do the green grape because of vitamin C and K and the antioxidant in it. Now, there is a question from Donna Douglas. Donna Douglas is asking, what about vitamin D? Yes. You want foods with vitamin D, or we mentioned some products with vitamin D, or what is the question? Benjamin, purple grape. Purple grape contains antioxidants and vitamin C. So it's still the same. The only grape that contains the lavestrol and reduces the cholesterol levels is the red grape, which I've said it helps in blood circulation, and so the others, they contain the antioxidants. And you Savior Man, you can take any grape you want to make sure that you are okay. But when you want to reduce the bad cholesterol and antioxidants and in your body, use the red grape. You get it? Use the red grape. Now, I was asking someone, Donna Douglas, vitamin D mostly you can find it in foods and the sun. The sun produces vitamin D. It helps synthesis vitamin D in your body. Now, we have talked much about everything today. We started by the heart conditions, and now we are here. I've gone up to around 2 hours, imagine, 2 hours talking about these issues. So I usually say, let me finish by saying, my sister, Donna Douglas has not answered me, but I'll say, in the US, it cold in the winter time, no sun. Oh, no sun. So you can take foods that have vitamin D, like fish, salmon, mackerel, sardines, tuna. They have vitamin D. Fish liver oil, but you consume moderately the fish liver oil. Don't just take eggs yolk. They produce moderate vitamins, easy incorporation. Vitamin D is in egg yolk. Mushroom, exposed to sunlight, but now there is no sunlight, so mushrooms will not give you a lot, but it will be some. Fortified foods like fortified milk, fortified cereals, fortified juices, fortified margarine, they contain vitamin D, so take them. Those are sources of vitamin D. Fatty fish, cod liver oil, egg yolk, mushroom, and fortified foods, and sunlight highest it can give, but sunlight there is minimal. So those are the foods that you can take. Thanks a lot. Thanks. Welcome. We have talked a lot about heart conditions and foods we should eat when we have these problems. Now, we have even, what is Xavier Man saying? Even with the sun, is still cold in the US in the winter. But you know, sometimes what helps is not the warmth. What helps is the rays of the sun. Xavier Man, when you're having the sun, when you are taking, when babies are being born and they are taken to the sun, they are not taken to the sun to feel warm. No, they are taken to the sun because of the UV rays of the sun and the blue rays. The rays are the ones which help you to synthesize vitamin D, not the warmth. Now you know. Yeah, now you know why we take children out. So it is 2 hours now, and tomorrow still we will have more challenge upon this. We thank everyone that have come to the channel tonight, and share the channel. We have a lot of playlists you can run. You can check the playlist that we have and see what can help you, the questions that you can come out, so that tomorrow when we are here again now to start another topic on autoimmune. Tomorrow we are starting on autoimmune infections and infections that your body is striking itself. Infections that are not brought by anything. You have a disease that your body itself is giving your body. Tomorrow is when we are starting it. If you have any question on heart diseases, but I will talk about, before I finish tomorrow, I'll talk about treatments of heart diseases on a quick mode, and then we will continue to introduce autoimmune infection. So everyone who has been here, who has liked, who has asked a question, thank you so much. Share this channel to your friends, share this channel to everyone. Let's interact. Xavier Man is here laughing at me always, asking me questions. I thank you. I can see Barry walking exercise here. I can see Donna here performing and asking questions. Thank you so much, Donna. I know it might be your first time. We are a bigger group. Cassandra here. We can see Stan's Kitchen in the house. We can see Mercy was here. All of you, we thank you. Let's meet tomorrow and big up. Good day, good night, good time, good evening, wherever you are. Let's meet tomorrow as we continue with our talks. Thank you much. Bye bye. Bye.